This is the hand, and a lot of ligaments here, and this is the median nerve, and this is called carpal tunnel. Okay, so the ligament goes from the upper arm all the way connected to the fingers, and there are main sensory nerves connected with this median nerve, and this median nerve eventually goes to the spine. Okay, so when this nerve is being compressed, very often then you develop carpal tunnel syndrome. Okay. Usually it affects index and middle fingers. Okay. And these are the cause, but these are all hypotheses. The problem is today we are not able to confirm. Okay, the median nerve is being compressed for too long. Okay, for example, you're typing and you compress here, years after years. Okay, so compression of the median nerve can result from occupational exposure to repeated trauma. And that increases the pressure in the carpal tunnel. Okay? And these are further explanation, but basically it's a compression of the median nerve. The symptoms is also a big issue. Everybody is different. Everybody complains differently to the doctors. Somebody feels it's numb, tingling, painful, burning sensation. Okay, over the thumb, index, middle fingers, one or both hands. Okay, sometimes occur most frequently at night. Okay. Difficulty in moving the fingers, loss of grip strength, okay. Loss of sensation in fingers, subjective feeling of swollen fingers. That's interesting. When we measure your fingers, it's not swollen, but you feel it's swollen. This is called subjective feeling of swollen finger, with or no swelling apparent. So when you develop this, some of the doctors will ask you to take some pills to calm you down. They are worried about that you develop, what is that? Psychic. But many, it's physical. See, it's a physical problem. But you feel, my fingers are growing, becomes thicker. Okay. There's a few diagnosis methods. One is called T-nails. You simply hit, tap here. See if you can feel the numb, feel the pain. And this one is called Phelan's test. See if you can do this. You can do this without any feeling that you are fine. If you do this and you feel something wrong there, kind of pain or numb, some feeling, then you probably develop carpal tunnel syndrome. Okay? And then if you feel something wrong this way, then you go to see a doctor. The doctor will arrange an EMG test. They measure how fast this EMG test measures. They will put a signal here. a stimulus, electrical signal, and then that will go through it, and then eventually go here, right? Because it goes through the median nerve. And if your nerve transfer time is slower than normal people, then you develop CTS. Normal people, from here, the stimulus goes from here to here within, say, 200 milliseconds. But you take 300 milliseconds, then you develop. You probably develop CTS. Okay? And there are other methods being developed more recently. Okay, this is kind of scary. This is also very common in low temperature logistics operation. People working in low temperature chamber. Poultry, meat, beef, processing. And your hand is exposed to cold. Construction workers using the vibrated machines. Construction workers, we hear this all the time in our campus. They never stop any maintenance, construction. Very noisy. Those people, it's called white fingers. Okay. This is one of the worst diseases associated with segmental vibration, also called Raynaud's syndrome. It's a narrowing of blood vessels in the hand. That's why it gets white, because the blood doesn't go here anymore. Okay? Progressive collapse of the blood vessels, recurrent episodes of blanching of the fingers, that means white. It becomes white, caused by exposure to hand-on vibration from handheld vibrating tools. This is the main one. Therefore, its name, vibration white finger. However, especially under cold. Okay? Two common triggering factors. One is exposure to cold, even related to emotional distress. So these problems are always accompanied by psychic problems. Okay. Whether this problem, physical problem, cause emotional distress, or emotional distress first and then cause this. See? Nobody knows. But it says here two common triggering factors. One is emotional distress.